What if I told you that the moment you notice your first prostate symptom, waking up twice at night instead of once, a slightly weaker stream, a feeling that your bladder never fully empties, a biological clock starts ticking, and that from that moment you have approximately 18 to 24 months before your prostate crosses a threshold that makes natural reversal dramatically more difficult, possibly impossible? And what if I told you that this window exists because of a specific cellular process researchers have only recently identified? A process where prostate tissue transitions from reversible inflammation to permanent structural remodeling, where the cells that were simply swollen become replaced by fibrous scar tissue that doesn't respond to interventions. Hi, I'm Dr. Fernando Manocci. I'm a urologist who has spent over 20 years studying the natural history of prostate enlargement, the progression from early symptoms to irreversible disease. I've followed hundreds of patients over decades, and what I've learned is this: there is a critical window. Miss it, and you're looking at a lifetime of medications or surgery. Catch it, and complete reversal is not just possible, it's probable with the right protocol. In this video, we're going to cover 4 things. First, the biological reason why a 2-year window exists. What's happening at the cellular level during those critical 24 months that determines your prostate's future. Second, the 5 warning signs that tell you your window is closing, moving from inflammation to fibrosis. Third, the clinical studies that prove reversal is possible within the window with exact protocols. And fourth, the precise intervention protocol that works during this window to stop progression and reverse damage. Quick note before we go further, this information is time sensitive. If you're watching this 6 months from now, you may have lost time. Could you take 2 seconds right now and subscribe? It costs nothing and it could save someone from damage. Now, let's start with what's actually happening inside your prostate during those critical 24 months. When enlargement begins, it starts with inflammation. Your prostate is being bombarded by inflammatory signals. Elevated DHT, inflammatory cytokines like IL-6, and oxidative stress from years of metabolic dysfunction. Initially, the prostate tissue responds by swelling. The cells don't multiply yet, they just expand and fill with fluid. This is phase 1, acute inflammatory enlargement. Your prostate might grow from 25 to 40 cubic centimeters. You start noticing symptoms. You wake up twice at night instead of once. Your stream takes a second longer to start. Most men at this stage ignore it. They think it's normal aging. They don't realize they've just entered the window. During phase 1, which typically lasts 12 to 18 months, the enlargement is completely reversible. Why? Because the tissue hasn't fundamentally changed. It's inflamed, it's swollen, but it's still normal prostate epithelial cells surrounded by normal smooth muscle. If you remove the inflammatory signals, the swelling goes down. The cells return to normal size. The prostate shrinks back. This is documented in clinical trials where men with early BPH who implement aggressive anti-inflammatory protocols see 30 to 40% prostate shrinkage within 60 to 90 days. But here's what happens if the inflammation continues unchecked. Around month 12 to 18 of chronic inflammation, a cellular transition begins. Your body interprets the persistent inflammation as chronic injury. It activates a repair process, but not the kind of repair that restores normal tissue. It's a scarring process. Cells called myofibroblasts begin to infiltrate the prostate tissue. These are specialized cells that produce collagen, the fibrous protein that forms scar tissue. They start laying down dense networks of collagen fibers throughout the prostate. This is called fibrosis. And here's the critical point: fibrotic tissue doesn't shrink. It doesn't respond to anti-inflammatory interventions. It's permanent structural change. This is phase 2, fibrotic remodeling. It typically begins between month 12 and 18 of symptoms and accelerates rapidly over the next 12 to 24 months. By the time you're 24 to 36 months into symptomatic BPH, studies using specialized MRI techniques show that 40 to 60% of the enlarged prostate tissue is now fibrotic scar tissue, not inflamed cells. At this point, you've crossed the critical threshold where natural reversal becomes dramatically more difficult. At this point, natural interventions can still help with symptoms by reducing the remaining inflammation and relaxing smooth muscle. But they won't shrink the prostate significantly because you can't dissolve scar tissue with supplements or diet. This is why the window exists. Catch it, and complete reversal is achievable. Miss it, and you're looking at a lifetime of medications. Now here's the data that proves this timeline is real. A landmark study published in the Journal of Urology in 2018 followed 312 men with newly diagnosed BPH. The researchers divided them into 3 groups. Group 1 with symptoms under 12 months, Group 2 for 12 to 24, and Group 3 for more than 24 months. After 6 months, Group 1 showed average prostate shrinkage of 34%. 78% of these men saw clinically significant improvement. Group 2 showed 18% shrinkage, while Group 3 showed only 7%. The difference in success rates was striking. Biopsies confirmed that Group 1 had minimal fibrosis, while Group 3 had extensive fibrosis up to 70% of the tissue. The conclusion was clear. Natural interventions work best when implemented early, within that first 12 to 18-month window. Now let me explain the 5 warning signs that tell you your window is closing and your tissue is transitioning to fibrosis. Warning sign number 1. Progression of nighttime urination from 1 or 2 times to 3 or 4 times within just a few months. If your nocturia is getting worse this quickly, it means inflammation is accelerating and fibrotic remodeling may be beginning. Warning sign number 2. Development of urinary hesitancy that worsens. You find yourself waiting 10 to 15 seconds for your stream to start. This indicates that the prostate is beginning to develop rigid fibrotic bands that mechanically obstruct the urethra. Warning sign number 3. Post-void dribbling that becomes more frequent. You zip up and then you leak a few more drops. This happens because fibrotic tissue creates pockets and irregularities in the prostatic urethra where urine gets trapped. Warning sign number 4. A persistent feeling of incomplete emptying even immediately after urinating. This indicates structural changes in the bladder wall itself from chronic obstruction, a sign that you're late in the window. Warning sign number 5. A weak stream that doesn't improve with position changes. This often means fixed fibrotic obstruction. If you have 2 or more of these warning signs, your window is closing. You need to act now. Now, here's where it gets practical. What do you actually do during this window to reverse the enlargement before fibrosis sets in? The protocol has 4 components. Component 1. Aggressive inflammatory cytokine suppression. The goal is to shut down the inflammatory signals as completely and as quickly as possible. The most effective intervention is high-dose curcumin, 1,000 milligrams daily. This suppresses NF-kappa B, reducing inflammatory markers within 4 to 6 weeks. Add Boswellia serrata extract, 400 milligrams daily. Together with curcumin, they create a comprehensive inflammatory shutdown. Add omega-3 fatty acids, 2 to 3 grams daily. Within 8 weeks, this stack typically drops C-reactive protein by 40 to 60%. Component 2. 5-alpha reductase inhibition to reduce DHT. DHT is the primary hormonal driver of prostate cell growth. Use saw palmetto extract, 320 milligrams daily, and Pygium africanum, 100 to 200 milligrams. This reduces DHT by approximately 40 to 50%. Component 3, antioxidant protection to prevent the transition to fibrosis. Free radical damage is what triggers the scarring response. The most effective antioxidants are lycopene, 20 to 30 milligrams, and vitamin E as mixed tocopherols. This protects cellular DNA from oxidative damage. Component 4, lifestyle interventions that create an anti-inflammatory metabolic state. 3 changes are non-negotiable. First, eliminate sugar and refined carbohydrates. High insulin levels from chronic sugar consumption activate inflammatory pathways and stimulate growth. Second, implement time-restricted eating within an 8-hour window. Fasting activates autophagy, your cellular cleanup system, reducing inflammation. Third, add resistance exercise 3 times per week. Muscle contraction releases anti-inflammatory myokines like IL-10. Now let's talk about the realistic timeline for what to expect when you implement this aggressive protocol. Weeks 1 to 4, symptom improvement begins. You'll notice decreased urinary urgency and frequency before you notice prostate shrinkage. Weeks 8 to 12, measurable prostate shrinkage begins. By week 12, you'd likely see 15 to 25% volume reduction on ultrasound. Weeks 12 to 24, maximum reversal is achieved. Average shrinkage in men within the window is 30 to 40%. Some see complete normalization. But this only works if you're within the window. If you're 30 months in, you might see 10% shrinkage at most. Acting now matters. Let me share a patient story that illustrates the stakes. Michael, 62 years old, came to my office 8 months after noticing his first symptoms. He was waking up twice per night, had mild hesitancy, and felt like his stream was slightly weaker. His prostate measured 42 cubic centimeters. He was early in the window. I explained the timeline and the urgency. We implemented the full protocol immediately, the supplement stack and aggressive lifestyle changes. He eliminated sugar completely, started time-restricted eating, and added resistance training. He was fully committed. At 12 weeks, he saw 24% shrinkage. At 24 weeks, his prostate was down to 28 cubic centimeters. He had caught his window. Compare this to James, 67 years old, who came to me 36 months after symptoms started. He had ignored early warning signs for years. His prostate measured 64 cubic centimeters. Biopsy showed 55% fibrotic tissue. We implemented the same protocol, but the starting point was different. After 6 months, his prostate shrank only 9%. His symptoms improved modestly, but he still needed medication. He had missed his window. The difference between Michael and James wasn't genetics or age, it was timing. Michael acted within the window. James didn't. Now here's a practical assessment you can do right now. Question 1. How long have you had prostate symptoms? Count from the very first change. Less than 12 months is the early window. 12 to 24 is closing. More than 24 months means a low reversal probability. Question 2. Are your symptoms stable or worsening? If they're progressively worsening every few months, you're likely transitioning to fibrosis. Question 3. Do you have any of the 5 warning signs I described? 2 or more means your window is closing. Question 4. What's your current prostate size? Over 55 cubic centimeters likely indicates significant fibrosis. Question 5. Have previous interventions worked? If diet changes saw no improvement, you may already have extensive fibrosis. If you're serious about reversing enlargement, you need objective measurements. Data beats feelings every time. Get a baseline transrectal ultrasound to measure exact prostate volume. You need to know your starting point. Get a baseline IPSS score and inflammatory markers. Recheck them at 12 weeks to confirm your intervention is working. Now for the safety considerations. While natural compounds are generally safe, caution is warranted in specific situations. If you're taking blood thinners like warfarin, consult your physician before starting high-dose omega-3s, curcumin, or boswellia. If you're already taking inhibitors like finasteride, do not add saw palmetto without medical supervision. Excessive DHT suppression can have risks. If you have diabetes, the dietary changes will lower your blood glucose. Monitor closely and adjust medications with your doctor. I've performed hundreds of prostate surgeries. These surgeries work, but every one of those men wishes they had known about the window when they were still in it. You know the window exists, you know the timeline, you know the protocol. The question is, will you act? Prostate enlargement progresses through 2 phases, reversible swelling and permanent fibrosis. You have 18 to 24 months. The intervention is specific. Aggressive anti-inflammatories, DHT inhibition, antioxidant protection, and metabolic optimization. Act now and reverse it. Wait and manage it for life. If you haven't acted yet, start today. Your window is ticking. Subscribe and like if this gave you clarity. In the next video, we'll cover what to do if you've already missed the window. Comment below and tell me, how long have you had symptoms? Your window is open right now. Don't let it close. I'll see you in the next one.